What major bacterial pathogens cause cystic fibrosis exacerbations? Imagine your lungs as a busy city where many bacteria live peacefully, but sometimes troublemakers cause chaos. In cystic fibrosis, certain bacteria are known to trigger worsening symptoms or flare-ups called exacerbations. These bacteria can make breathing harder and lead to more lung damage if not managed properly. Let's explore the main culprits behind these episodes. The most common bacteria in young children with cystic fibrosis is Staphylococcus aureus. This bacteria often shows up early in life and can cause infections that lead to increased coughing and breathing difficulty. Both methicillin-sensitive and resistant strains, known as MRSA, can infect the lungs. While some studies debate how much Staphylococcus aureus worsens lung disease, treating these infections early has been shown to help improve health and prolong lung function. As children grow into teenagers and adults, Pseudomonas aeruginosa becomes the main concern. This bacteria is notorious for establishing long-term, chronic infections. It forms protective layers called biofilms, especially mucoid strains that are tough to treat. These biofilms shield the bacteria from antibiotics and the immune system, making infections persistent. When Pseudomonas aeruginosa takes hold, it often leads to more frequent flare-ups, faster decline in lung function, and increased hospital visits. Managing this bacteria is a key part of cystic fibrosis care. Another bacteria that can cause serious problems is Burkholderia cepacia complex. This group of bacteria is particularly aggressive and resistant to many antibiotics. Infection with Burkholderia can cause rapid lung deterioration and is linked to worse overall outcomes. It can spread easily between patients if infection control measures are not followed, making prevention crucial. In younger children, Haemophilus influenzae is also common. It tends to cause early infections and can contribute to exacerbations, often coexisting with other bacteria like Staphylococcus aureus. While less common in adults, it still plays a role in the complex bacterial landscape of cystic fibrosis lungs. Less frequently, bacteria like Pseudomonas maltophilia and Acromobacter xylosoxidans can colonize the airways. These opportunistic pathogens are more common in patients with advanced lung disease or those who have had many courses of antibiotics. They can also contribute to exacerbations and complicate treatment. It's important to remember that cystic fibrosis lungs often host multiple bacteria at once, creating a complex environment. Viral infections, such as respiratory syncytial virus or influenza, can also worsen bacterial colonization and lead to flare-ups by increasing inflammation and bacterial growth. Early detection of these bacteria through regular testing is vital. Prompt treatment with targeted antibiotics can help control infections, reduce the frequency of exacerbations, and slow lung damage. Managing biofilm-forming bacteria like Pseudomonas aeruginosa can be especially challenging, but ongoing research and tailored therapies are making progress. In summary, the main bacterial pathogens that cause cystic fibrosis exacerbations include Staphylococcus aureus, especially in children, Pseudomonas aeruginosa, Burkholderia cepacia complex, Haemophilus influenzae, Pseudomonas maltophilia, and Acromobacter xylosoxidans. Each plays a unique role in the progression of lung disease, highlighting the importance of vigilant microbiological monitoring and personalized treatment plans. Always consult your healthcare team for advice tailored to your specific situation, and remember that managing these infections is a key part of living well with cystic fibrosis.